Good afternoon again, and welcome to the Men's Health Network and the Congressional Men's Health Caucus joint briefing on CHIP, the Children's Health Insurance Program. My name is Fadich, and I am the Vice President of Men's Health Network. We are a nonprofit organization based here in Washington, D.C. We have spent many years working closely with the Congressional Men's Health Caucus and our co-chairs, Congressman Markwayne Mullin of Oklahoma and Congressman Donald Payne Jr. of New Jersey. Our first speaker is Dr. Arthur Evans, Jr. He is the CEO of the American Psychological Association. Dr. Evans has been recognized nationally for his work in behavioral health care policy and the transformation of services delivery systems. More recently, Dr. Evans just completed 12 years at the Commissioner of Philadelphia's Department of Behavioral Health and Intellectual Disability Services, a $1 billion healthcare agency. Dr. Evans has also held faculty appointments at the Yale University School of Medicine and the University of Pennsylvania Perelman School of Medicine. Dr. Evans?
Good afternoon. So I'm going to talk about mental health and its importance in the CHIP program. Excuse me, just by way of introduction, Anna mentioned that I was commissioner in Philadelphia. I was also a deputy commissioner in Connecticut. So I've worked in public policy, mental health public policy for the past 20 years up until March of this year. Connecticut, one of the wealthiest states in the country, and Philadelphia, one of the poorest major cities, or has a high proportion of poor children in the city. And I can tell you that whether we're talking about very wealthy communities or communities that have some very significant issues around poverty, that the issues are very similar, and they're the same, they're pervasive. Suicide is the second leading cause of death for children or for young people between the ages of 15 and 24. If you look at our juvenile justice systems, disproportionately the kids who are in that system, particularly kids of color, are kids who have had mental health challenges. And so if we care about children, you have to care about mental health. Okay, so let me talk about why we want to focus on children's mental health, and in particular as it relates to the CHIPS program. More than 40% of the children have experienced a behavioral health problem, and I'm going to use the term behavioral health because that includes both mental health services and substance use services, which are a major problem for many adolescents. 70% of the mental disorders occur before the age of 25. When people have mental health challenges, they typically occur in early adulthood or in adolescence. Over the course of a year, 1 in 5 children will experience a mental health challenge, and only 20% of them will actually access services. When it comes to men and boys, the issues are even more challenging. Males are less likely to seek help. Males have a much higher rate of suicide, although girls and women attempt at a greater rate. Boys and men complete at a much higher rate. And so when we're talking about men and boys, even more significant issues. So CHIP is really important because it provides an important source of funding for mental health services for adolescents and children. And those services cover a range of treatment programs that are needed. So typically, a child might need anything from an outpatient treatment program to a partial hospital program to a residential program to an inpatient treatment program. All of those services are covered by the CHIP program and really are essential for meeting the comprehensive needs of children. So the program has sort of 2 tiers, one for those programs who are connected to the state Medicaid program, in which case the behavioral health services are aligned with the federal parity requirements. But even for those that are not a part of the state Medicaid program, most states and most CHIP programs have both inpatient and outpatient services. I mentioned that the program affords a continuum of services. Those turn out to be very important for the kinds of outcomes that children need in those programs if they're going to be successful in school and so forth. I want to give you one example of why this funding is so important. It's clear that when children have access to services, it benefits the children. But one of the things that is probably not understood quite as much is the importance of this funding for building infrastructure in communities. And I want to use the example of childhood trauma. There's quite a bit of research that shows that early adverse events in childhood have a profound impact on the trajectory of children and adults' lives. So children who experience a series of adverse childhood events, much more likely to have physical health problems, much more likely to have mental health problems, much more likely to have social problems, like homelessness and so forth. And so if we can intervene early for those kinds of adverse events, it can make a big difference in children's lives. We use some of the work that has been done in Philadelphia. This is a map of the city of Philadelphia. And the dots that you see there are evidence-based treatment programs in the treatment of trauma for children. The city was able to do that because of the funding that's afforded through, in this case, the Medicaid program and CHIP program. And what the city did, because of this phenomena of trauma and its impact on children, started to screen children in primary care pediatric settings. So over the course of a couple of years, over 30,000 children were screened. About 10% of them screened positive for PTSD. Those kids were then referred to those evidence-based treatment programs and treated. Now, if you know anything about what happens when children have early childhood trauma that goes untreated, it results in things like significant substance use in adulthood. It results in significant social problems, as I mentioned, and it results in significant healthcare problems that are very costly to our system. So by intervening early, we're able to prevent a life of challenges for people, but it's also good policy because it saves us money on the back end. This kind of work could not happen without the kind of funding that CHIP provides, which allows providers to get the training and to build the infrastructure and capacity to deal with these issues. So in conclusion, very important to include mental health services in these kinds of programs because of the impact that it has. Social and emotional problems is one of the biggest predictors of how children will do in school. And so if we're concerned about children's health in general, this kind of program is enormously important. So thank you very much.